Hey guys, it's Dr. Akiba Green here. I've got a special report for you this morning. We're talking about genetic modification. We're actually talking about a product that's in a lot of products that we're eating. It's called brominated vegetable oil. I want to talk about the effects of BVO on our health. Now, in 1997, a man presented to the emergency room with headaches, fatigue, loss of muscle coordination, and memory. He continued to get worse over time, and actually he lost the ability to walk. A blood test found sky-high levels of bromide. The source, the man had been drinking between 2 and 4 liters of soda containing brominated vegetable oil every day. He actually needed dialysis. He eventually did recover, but we're talking about soda-induced kidney failure because of this one ingredient. In 2003, doctors treated a man who developed swollen hands with oozing sores. It's pretty disgusting. They diagnosed a rare case of the skin condition, bromoderma. After blood tests revealed his bromide level was twice normal limits. The man admitted drinking 8 liters of a product called Ruby Red Squirt, which contains BVO, every single day. Why are these two cases important? Because PepsiCo, the parent company of Gatorade, just announced that it's going to be removing brominated vegetable oil from its Gatorade drinks in response to customer concerns. Not because it's bad for you, mind you. PepsiCo won't admit that, but because enough people have started asking them, why is there bromide in my Gatorade? Now, what is brominated vegetable oil, BVO, and what is it doing in your sports drink? It's a great question. It's actually a synthetic chemical. It's created when vegetable oil is bonded to the element bromine. Now, bromine is heavy. It keeps the oil from floating to the top of water-based solutions like soft drinks. So what happens is citrus flavors, orange, lemon, lime, grapefruit, are very oily. So when they're added into a soda or a beverage like Gatorade or Mountain Dew, they tend to sit on top of the drink. They don't mix all the way through. So companies take BVO and use it as an emulsifier, which means it helps the citrus flavors mix better into the soft drinks. Drinks that contain BVO, you will always know it because they look hazy or cloudy. Now, Mountain Dew, Fresca, Fanta, even sports drinks like Powerade and Gatorade have had BVO added to them for years. And believe it or not, many drinks contain BVO, and it's not even on their labels. So the problem is that BVO is actually banned worldwide in over 100 countries. And even the FDA has considered it unsafe since the 1970s, yet does nothing to ban its usage here in our country. It helps if we look back at the history of BVO in our regulatory system. Now, in 1958, the FDA said BVO was considered generally safe to use. The rule was made when it was generally used in very low amounts in the body, about 8 parts per million. And really, quite honestly, when this rule was made, sodas were considered a treat, were not part of the daily diet. The FDA actually said that up to 15 parts per million were accepted, but most people only used about 8. So remember I said earlier that one guy got sick after twice the daily limit? So if you think about it, the daily limit that's acceptable to the FDA is 15 parts per million, but they were only using 8. So already people have doubled their use of it in that time period. It gets worse though. In the 1970s, the FDA actually said, hey, wait a minute, let's look at BVO a little closer. And they gave it what's called interim status. This means that beverage manufacturers can use it in limited amounts, pending the outcome of further studies. They said there may be something wrong here. We need to look closer. You can still use it, beverage companies, but don't use a lot of it. Well, so the FDA understood there were health risks associated with BVO. They made that change. The rules they used were very important. The safety of America's health was paramount to the FDA in the 1970s. Well, what has happened is those studies never got done, leaving the ingredient in limbo for more than 30 years. Today, the way consumers drink sodas is very different from the 1950s. Since the FDA is driven as much, or if not more, by special interest groups, they're very hesitant to make any changes that will force companies to remove something that they've said was safe for now 60 years. It's almost like 20 years in, they said it's bad, but they never did anything about it. So how can they say it's bad when they've allowed it to be safe for so long? Well, you know what? The rest of the world feels differently. Like I said, over 100 countries have banned brominated vegetable oil. Japan, India, the entire European Union are some of those example countries. They get how bad it is for you. Exactly how bad is it for us? Brominated vegetable oil, like I said earlier, has its composition in the element of bromine, in which, believe it or not, the vapors of bromine are considered both corrosive and toxic. In other words, it can outrightly be considered a poisonous chemical. The chemical bromine is used for a number of products, from one of the chemicals that treats surfaces for light-sensitive photographic printing papers, as an additive for gasoline, to agricultural fumigants. One time, bromine was even used to make sedatives But then the FDA banned its usage in 1975 as it was found to trigger a whole host of psychiatric disorders. The FDA claims that BVO in acceptable levels does no harm. However, it has been proven that BVO, when consumed, is stored in a person's fat cells. Thus, over time, it accumulates. So every time you have it, you're not getting rid of it. You're just adding more and more parts per million to your body until at a certain point, symptoms hit. With time, if the average person consumes enough of these beverages that contain BVO, the toxic side effects have started to show up. Now, what are the side effects? Do you really want to know? A lot of work I do with autoimmune patients is with thyroid management. Probably 50% of my patient population is hypothyroid or Hashimoto's, which is autoimmune thyroid disease. The website Natural Thyroid Choices listed the following symptoms associated with Mountain Dew and BVO: abdominal cramps, anxiety, anorexia, blurred vision, coma, constricted pupils, convulsions, cyanosis, that's where you get bluing of the skin, diarrhea, dizziness, heartbeat malfunction, headache, weakness, tremors, muscle cramps, nausea, respiratory difficulty, salivation problems, slow pulse, sweating, tearing, vomiting. Also, birth defects, growth problems, memory loss, and fatigue have been shown to be associated with BVO in the literature. And yet, adults and children both consume these beverages on a daily basis with no thought at all about the consequences. There's nothing sicker that comes to mind when I'm doing research for this story that knowing the fact that I've had Gatorades, tons of them, we all have. My daughter has drank Gatorade, and knowing what's in it and knowing that it's not even on the label, to know what you're giving your children. The Wonder Drink Gatorade is used so much after sports activities. Again, people think it's just to rehydrate and replenish, but what they're getting is a dose of a toxic chemical. All of us have been drugging our children and drugging ourselves without even realizing it, because the FDA was too lazy to do anything about it in the 1970s when they should have said there was a problem. And actually, they did say there was a problem, and they said we need to do research, but the research was never done. So my goal with these videos is to put pressure on the FDA to start doing their job. I'm hopeful we'll see the complete ban of BVO in beverages in our country, just like 100 other countries have done for years, just like PepsiCo has announced they're going to do with Gatorade, but it will take months to reformulate. Yeah, because that emulsifier is the only emulsifier that exists. No, wrong. There's a million emulsifiers that are out there. Every product we have has some kind of an emulsifier. Even the safe, natural, organic dressings that you can buy have emulsifiers in them. You'd think the FDA would agree our health is worth it and force them to make a quicker change. If you're interested in learning more about genetically modified foods, the health risks associated with them, and how my office can help you with your chronic health problems, I encourage you to call and schedule either an in-office consultation or a distance medicine consult with me. My name is Dr. Akiba Green. My office number is 704-987-3993. My website is www.drakibagreen.com. That's drakibagreen.com. Thank you for listening, and I'll talk to you soon.